If you think eating disorders are mainly about food, you are already missing the point. These disorders are often about control, shame, anxiety, self-worth, and emotional survival. Food is the battleground. It is usually not the whole story. The moral of the story will always be to let the patient lead the way. To start, here is the fast way to think about the big three. Anorexia is mostly about restriction. The person is limiting food, often with intense fear around weight gain, and very often with a powerful need for control. A lot of people with anorexia can seem disciplined, rigid, perfectionistic, or obsessive. Sometimes there are family dynamics around control too. The classic controlling mother can be part of the picture, but it is not the whole story, and it is definitely not every case. Bulimia is mostly about binging and then trying to undo it. So there is a loss of control leading episode, then purging, fasting, overexercise, or something else meant to cancel it out. A lot of the suffering here lives in secrecy, panic, and shame. Binge eating disorder is binging without that regular undoing. It's a binge if there's a loss of control and significant regret. Like bulimia, there is still guilt, still humiliation, still distress, but not the same ongoing pattern of compensating afterward. So the simplest version is this. Anorexia is restriction. Bulimia is binge plus compensation. Binge eating disorder is just binging. That's easy. Here's what is hard. Never assume a person is casual about what the diagnosis means to them. Some people feel ashamed of the label, some feel relieved by it, some feel attached to it, even if they do not fully meet criteria at that moment. So you do not want to be careless just because you think you are being objective. Same goes for questions about weight. Same goes for asking someone to track weights. Same goes for body image, binging, purging, any of it. Even when those questions are clinically necessary, this is sensitive ground. What feels like routine information gathering to you may feel loaded, exposing, or destabilizing to them. And if someone is already working with a therapist, let the therapist lead the deeper psychological work. Bring in nutritionists or dietitians pretty freely too, especially ones who know eating disorders well. A lot of the time, the most useful thing for you to do is helping with the mood and anxiety symptoms that are driving the whole cycle. Make it easy for yourself and let the patient lead the way.